too. I'm gonna just start a little
That was
bit
a good thing about my ex-wife. At least she didn't mind picking my back, you know.
Ah. And then you know, we always kind of joke. Are you okay? By the way, a little pressure.
Don't even
Nothing.
feel
Oh,
it.
look at you. You know, I always kind of joke we should start a pimple popping matchmaker site. I feel like you'd be hot property for somebody who likes pimple popping. Might sound funny,
And you
but
know,
it's true.
my girlfriend, she's an esthetician.
Yeah. Okay.
And she won't do it.
Oh, really? That's funny.
I thought, why did you get involved with that if you're not? You know?
I will say, usually estheticians are like the ones that are really follow this stuff. But I will say, you know what? My best friend just started esthetician school. She's not into it, so she likes facials and
Yeah, she likes doing makeup and
yeah,
stuff like
yeah,
that.
Exactly. So I guess I could see it. Some of them don't respond as well. That I might need to make a little nick in the skin, but some of them I might do a little nick right here.
Well, years ago they would use like that little
Close. You want to move from
that
closer?
thing.
What, this little pink right here, what I'm doing right now?
Yeah,
a little poke.
Does it cut like 3/4 or so?
It's just a little. It's actually
Three-quarter
just
circle?
no. Oh, punch. We do use that, but I'm not using that on you.
Oh.
That's a big like excision actually that you usually have to put stitches in.
Well, I remember. They would use those years ago.
Yeah, we still use those, but not for. You got some good ones in here.
I told you.
I know. You're like a little. What are we gonna call you? We already have gold mine of blackheads. We already got that label. We gotta think of you. Like, think of a name for you. Any nicknames people call you?
The hardest part for me to get to is like where your hand goes across there, down.
Right here. Okay, we'll definitely try to get
Because I
close.
can't reach.
Yeah. I mean, how do you even do it though? Even with one hand, it's not so easy.
I got a stick and I put one of those gills you use around your nose, you know. And I taped it on.
Wow.
And I get it at a certain angle.
Yeah,
and I have 2 mirrors, and I'll get back up there.
Because is it satisfying for you too, or it just makes you feel cleaner, like you just feel like you want to get them out?
They itch sometimes, and you just want to get them out. You have to open them, you know.
Right.
And my arms don't move that way, so in order just to relieve the pressure, that's what I have to do.
Anyone's arms that move that way, yeah. Some people find this actually. I've had a few patients who I've done this on their back and they like fall asleep. They're like, it's so soothing actually.
Well, sometimes it is. I've fallen asleep before.
Yeah.
My ex-wife would do it.
Do you ever talk to her? I wonder if she ever says she misses this.
It's
okay. Really. You don't have to reach out to her. Just for me, okay?
No, not really.
I'm just curious.
I actually just talked to her yesterday.
Oh, really? Well, that's nice. You still can be, you know.
Yes, my grandson lives with her, and our son went to prison over stupidity.
I'm sorry.
And he took the police on a high-speed chase with his son in the back seat.
Jeez.
So his son's 14 now, my grandson, and I pay for his cell phone. So she called me and asked if I would let them know it's my phone that the son's calling to, because she used her credit card to pay for it for the time.
Oh.
So I have to call this phone company and let them know that it's okay for him to call.
Got it. Well,
but she bailed him out, and he got himself in more trouble after she bailed him out.
The 14-year-old, huh?
No.
The dad. Oh.
No, he's 37.
Well, it's hard. I was just talking about this with one of my other patients that they never end up stop being your kid, you know. And one of my other patients was talking to me about how his nephew came in and during this whole pandemic, and he like stole from her because he was involved with drugs and things, and it's so hard to do it. It's hard to, you know. I'm not saying that's your case, but they never stop being your kids. You know what I mean? Right. No matter what they do. So
I have 3 daughters. Right. And the one that lives over here, she's the youngest, and she does where she calls people if their pacemaker batteries and stuff start to go out. She got Employee of the Month last year.
Oh, that's awesome. Oh, and you know, I wasn't saying anything about, you know, I just was saying about how it's so hard with kids. Like, I was just lamenting with my friend there that no matter what, they never stop being with kids, no matter how old they are.
Yeah, she got a 3-year-old that, oh God, was a handful.
Really? Yes. Payback for her, huh?
No, she was a good kid.
Oh, she was.
She was a good kid.
I would get payback.
My second daughter, the middle one, I just saw her in San Diego yesterday. She does Alzheimer's research at SC. Matter of fact, she's getting her master's. When did she tell
You have
me?
wonderful
Next
kids.
month.
That's amazing.
She'll be getting her master's. So. Then my oldest sells wood from Amazon.
That's great. So that wood, you say?
Yeah.
See, that's really entrepreneurial, you know? Like all these things that people figure out. I feel like even during the pandemic, like people find ways to pivot, you know, and figure things out. I don't know if that was during the pandemic or it kind of really took off.
Amazon's the lung of the world, you know?
Yeah.
You get a lot of oxygen from there. And the way, well, I guess they harvest all those trees, you know?
Really?
The wood is supposed to be like it lasts, you know, for quite a long time if you want to use it for
what country
pets and
from?
stuff. The Amazon, Brazil.
Oh, wait. On film, on video now, huh? I see. I see how it goes. Well, that's cool. Okay, because I actually had a table made from reclaimed, I think reclaimed.
A live edge?
The kind, I mean, it's almost like a butcher block, no, not a live edge.
Oh, she's got live edge.
It was a long time ago. I don't even think that was a big thing. It's but it's like the butcher block where it's like pieces of reclaimed wood all put together. Yeah. So
Yeah,
it's not
she's
that
got
fancy.
live edge table in her
That
house.
sounds interesting. I think
She
I could
bought the wood,
talk to her
laminated
about
it,
that.
had a friend of mine build a stand.
That's beautiful, and that's expensive. Those pieces of some of those trees that have been alive for so long.
Yeah, it's interesting the way they cut them and get them ready. See, down in there is where I can't get.
Okay, I'm going to. Yeah, you've been for a little. That's great.
And that's the.
Your positioning here, that must be crazy in itself. Yeah, but you can see these are the big ones here because you can't get to them.
Yeah. You're my idol now.
Some of them are like in like little double comedones, like there are two openings to them.
Yeah. Do they come out fairly easy? Or?
Yeah, that's why we're still here. That's why we're still working away and we're moving slowly because there's a lot of them and they're actually responding, so that's good. Sometimes I squeeze one area and multiple come up from different areas around it.
Well, I'll do that with on my face actually.
Yeah, you got an oily complexion, I see. But it'll keep you looking young. That's a good thing.
What can I do about? I've been doing your the benzoyl peroxide with other stuff, whatever's in it now.
You know, I think even for your back, you might even want to try like a salicylic acid wash, like or even a spray, because that will help to settle down in the pores and keep these.
Well, I wash with the salicylic acid.
Okay, good. But you can also there's even a spray, like if you can't get to the shower or something.
I've seen your products, and I'm like,
I'll give you one.
The reason why I came here is I asked what's the girl that I've been seeing here?
One of the
Kristen.
Okay.
So I told her main reason I came here, I see all your products, but I want to know which ones will work and which ones can help me.
Right.
So.
Well, in a dermatologist's office, we tend to give you okay? You want to be only halfway through the upper back here. But yeah, I'll give you something like that and see if that'll help you, because there's also a spray that we have, so it's actually easy to apply to your back then. You don't have to it has like a 360-degree nozzle, so you can just spray upside down and things like that.
What about your wipes? I've seen those.
The wipes are fine. The wipes are great, but you're also going to get more. I tend to use those or recommend those for more when people have a lot of makeup and they're just trying to, or a lot of oil and sweating, they're just trying to take that off.
I do drywall work.
Okay, all right. Yeah, okay, so it's good to do that at work and you don't have to wash your face, right?
During the day,
you don't have time to sit there.
Usually dusty, because it might be dirt, it might be drywall dust,
I understand.
it might be
that
spray.
Is a good thing to use then, sure. I don't know if we have any right now here. But if we do have an empty bag, we can give that to him if we have one of them, but I'm not sure if we have any right now. We'll take a look.
I've been to a lot of dermatologists all my life. I did Accutane.
Yeah, like I said, I think you're like a dermatologist dream, just seeing your skin type kind of thing. But that's good. That's probably, I know it's probably been very, you know, frustrating because, you know, when you get bad acne in your kid, you got to be pretty proactive about doing it, and sometimes it's not so easy.
There's a lot of sports I wanted to play, but because of my back, I mean, I would have someone hit me in the back and something would pop open and blood be coming down my back, you know. So I decided not to go wrestling.
Such a contact sport there, and then, you know, it messes up your ability to do the things you want to do, and no, that's the hard part. I'd say that all the time, you know, but acne doesn't threaten our life, but it certainly threatens our mental life, you know.
Oh, definitely.
Because it definitely affects your ability to, sorry, little pinches here, ability to do things that you want to do, holds us back.
So you deal with the mental aspect of it also?
Well, that's part of why we treat people and why we encourage people to get treated, right? Because we want them to, again, like, you know, sometimes people will have bad acne and they'll go to their parents and they'll say, can you please take, because, you know, they're teenagers, they usually can't go on their own, and their parents may say, I mean, there could be money, of course, the reason why they can't do it, you know, or time, but they might say, oh, you'll be okay, but they don't realize that how that might affect a person. But I think they do. It's just that it's hard. You wonder, like, should I get this treated? Should I actually go see a doctor? Or should I try, you know, should I just try to wait it out? But if you get scarring, that's the thing that
my first year in college, I was up at Cal Poly, San Luis Obispo.
Mm-hmm.
And I was getting cystic acne on my jawbones like the size of golf balls.
Yeah, I can see you had bad acne.
And back then, they would spray you with Freon. Then they'd hit you with a scalpel. And then what was inside would hit the wall and the doctor.
Better not happen to us.
Well,
you almost got threatened for a second there, I think.
Well, last year, the year before, I had something cut out of my face, and the doctor pressed on it and splashed him in the face. He goes, we're not doing no more. And he got up and walked out all pissed off.
Not your fault.
And then the girl that sewed me up, the skin wasn't even straight. I've seen the way you're like, oh, this is so good, so that way, you know. She had a big old piece of loop of skin sticking up, and I looked at her and went, what a terrible sewing job. I can sew better than that.
Some places are hard to sew up because they're not like, when you have a circle, it's really hard to sew it straight to a square. But instead it settled down. Oh, sorry.
She just
tried.
She wasn't good.
I tried.
I mean, I inherited the shakes, and she was as bad as me.
So did your kids have bad acne?
My son, yes.
Did you go and you probably tried to get him because you were on Accutane yourself, so you knew about it, so you probably got him on something like that if you knew. That's great. That's what I noticed. Like kids that come in, like even the moment they have one little acne bump or minor acne, it's because their parents, their parents had to go through it, and they know they don't want to go through the same thing.
My girls didn't really break out that much, a little bit, but not too much. But my son pretty much inherited. His isn't quite as bad as mine. But he did get the cystic acne on his face, and he's got some of the same lumps that I have in the same places.
It sounds like you're pretty proud of your family. You got a good kid. You got good kids there. Good family, though.
Well, I was a single parent, and my girls were between 16 and 10. 3 girls. I was a single father.
Wow.
So my girls said, well, Dad, you helped Andy coach baseball, so you got to go with us.
What did you do?
I was president of the Cheerleaders Parents Club.
Oh, good for you. Did you know all the cheers?
Oh, no. I was more involved with raising money for them.
Oh, got it.
So they could do competitions.
Good for you.
I'd walk up with a clipboard, I'm here to turn my girls in for a competition. Yeah. They look at me like...
That's right. You're like dance dad.
I was.
If you like blackheads, and I know you do, then you should watch my most popular blackhead videos here.